Hi and Assalamualaikum to my dear FATIN Alia and our fellow classmates. So today, my group will be presenting on our article that has been chosen by us about the factors of mental health and its effect. Mental health includes one's psychological, emotional and social well-being. It also helps in determining how individuals handle stress, makes choices and relates to others. Mental health can affect individual daily life activities, relationship and also physical health. So mental health is referred to the condition of cognitive and behavioral well-being. Sometimes the term of mental health is used to determine the absence of a mental disorder. It is the condition of well-being whereby each person realizes their potential and can deal with their life changes and uncertainty. A mental illness is a brain disease that causes problems with thinking, behavior, energy or emotion that make it difficult to comply with everyday life responsibility. On the other hand, mental health and mental illness together go hand in hand. Individuals having optimal mental health conditions can also face mental illness, where people who have no mental illness can also have poor mental health. So, in recent times, people have started taking mental health seriously and taking proper steps in dealing with any mental health issues. People suffering from mental health issues may show various symptoms such as little or no energy, pushing away people and pulling themselves back from regular activities, loss of sleep or the will to eat, feeling helpless, harming themselves and many more. Without further ado, I will pass to my friends to explain about what is the factor and effect of the mental health.
Hi, my name is Nurul Binti Johari. So I will continue by explaining about the common mental health problems that often occur among adolescents. According to Michelle 2005, he stated that it is normal for adolescents to have variations of mood and temporary deviant behavior because these are part of the normal adolescent process and assumed it's normal for young people to feel depressed until last for several days. Besides referring to Michelle 2005, delinquent behaviors exhibited by adolescents and experimental activities with drugs are examples of behaviors as part of a normal exploration of their own identities. Plus, according to Michelle 2005, said that the difference in whether this behavior is a normal behavior or not can be determined by the effects of unstable mental symptoms experienced by adolescents, the duration of this behavior, and their persistence to practice this behavior. So, it requires basic requisites including a non-judgmental approach that recognizes the adolescent's right to confidentiality where appropriate for the level of risk involved to facilitate in assessing young people's risk in non-mental health to be categorized as primary or secondary care suggested by Michelle 2005. Therefore, according to HAC 2005, said that to assess the risk of serious mental health problems among adolescents can be measured through several validated screening questionnaires. Next, according to Michelle 2005, he stated that the highest depression case assessment record that has been recorded is regarding suicidal or self-harming behavior. So, Michelle 2005 said that assessments in managing adolescent depression have fallen in the category of primary care practitioners because around 8% to 10% of adolescents have been recorded to experience severe depression, thus becoming a major burden. Furthermore, referring to Michelle 2005, also said that this problem occurs due to adolescents sees the transition from childhood depressive illnesses such as regarding depression rate cases, which namely male or female predominant systems much to more adult forms that can lead to a greater likelihood of presenting depression mood. Therefore, based on Michelle 2005, he suggests that interview confidentially session to gather additional information from parents as well as other sources must be conducted because it is essential to assess potential suicide risk in depressed adolescents by asking them about past and present suicidal ideation, self-harming behavior, past attempts, and whether they plan to harm themselves to evaluate the risk of depression properly. Hence, Michelle 2005 suggests that several treatments such as psychotherapy, drug treatment, and a mixture of measures directed at improving them, the home and school environment needs to undergo by adolescents who experience this symptom to overcome their depression illnesses.
Everyone needs to know that mental health can affect physical health. But how? So let me tell you guys on how mental health could affect physical health. Ornberger 2017 stated that poor mental health can create poor physical health or dangerous behavior, while positive mental health can decrease the dangers of cardiovascular failures and strokes. Ornberger 2017 also said that chronic disease such as depression has been connected to numerous diseases incorporating diabetes, asthma, malignant growths, cardiovascular illness, and joint pain, which are the effects of mental health. May 2013 in the article has mentioned individuals with mental health problems have a risk of death from malignant growths and coronary illness. Again, Ornberger 2017 also said around half to 80% of people with poor mental health conditions will moreover have sleeping issues, which can similarly disturb existing psychological well-being. Also, physical and mental health may influence each other through employment, by which it is started by lack of rest or stress at work, cited by Contoyani and Rees 2001. Next, according to Stanford 2005 and WHO 2009, it is stated that physical activity, alcohol consumption, smoking, and diet are lifestyle choices that are associated with physical and mental health. According to Ornberger 2017, smoking might be utilized as a method for letting indications free from misery and turn to an addiction, as people who have mental health problems tend to smoke a big number of cigarettes, and the nicotine in cigarettes triggers the development of the synthetic dopamine. Moreover, according to Rim 2010 and Fisher 2015, outrageous alcohol consuming can lead someone with mental health problem to psychosis, which is an extreme mental illness such as delusions and hallucinations, which then can prompt activities they may not in any case have taken, including self-hurt and suicide. Hoffman 2003 in the article said that an insufficient eating routine can slow down reaction time, impair decision making, and fatigue, even prompt stress and depression. Meanwhile, people with a well-balanced diet can assist them with thinking rationally and alternately. Lastly, according to Mujic and Oswald 2016, exercise regularly is one of the gainful impacts of mental health, as it can decrease nervousness, despondency, and negative mindset, and by working on confidence and intellectual function.
Next, let us see together what is the shape and stigma of mental illness. First and foremost, according to Guy et al. In 2013, dangerousness and violence is often the preconceptions associated with the mental illness. People with mental illness are always being viewed as an aggressive individual who have distorted thinking pattern that acts erratically and should be avoided, as White mentions by Rose in 2009. Nikki in 1966 stated that according to a study that are made in the state of North India, a significant segment of society fear these mentally impaired people and they tend to shun them out. Due to it, all this stigma has caused internal and external damage toward this group of people, as according to Brian in 2001, where these people will develop decrease in self-esteem, increase in shame, having anxiety, avoiding people as they continue to receive discrimination, prejudice, backlash, exclusion, and also negative stereotypes from the society, making them putting distance from the outside world. Not only that, but Cut Life in 2001 added that media plays a vital role in creating this stigma, as the negative depictions from the media has caused more stereotypes. Other than that, Guy et al. 2013 added that mentally ill people are not only being stigmatized by the public, but also by the mental health professional. Bijokman 2008 mentioned that in comparison with the general public, mental health professionals are less being thrilled about the diagnosis and less confident in the long-term outcome that the mentally ill people can get better and could be helped. It is further stipulated by the Chambers et al. 2010, where there is numerous study over nurses' attitude are being conducted to see the perception over these people, as nurses are among the closest people who have direct interactions with them. As per the research, it was found that nurses are more prone to have the misconceptions over the mentally ill people, believing they are aggressive although they are on the professional field, as according to Halter in 2008. Because of that, Guy et al. Mentioned that nerds are seen to have more power to affect the thinking and influence general public about the stigma over the people who suffered from mental illness by feeding them widespread of unpleasant ideas instead of combating the backlash of sentiments, as they are the ones who should understand the situation and the people the most.
Mental illness, people can give bad effect to the family members. It is well understood that families are negatively affected when a member has a mental illness. The specific effects of mental illness on family has been studied extensively, with particular attention given to the burdens of caregiving. As a result of deinstitutionalizations, more seriously mentally ill patients are being sent home after stay at the hospital, and families need bear much of the burden for their care. Research on caregivers of persons with mental illness often examines both objective burden, such as family disruptions, financial crises, limitations on activities of daily living, and social instructions. Meanwhile, subjective, which is a perceived of feeling of getting overwhelmed by care they are providing. One reason of this may be the stigma surrounding mental illness. It has been long known that people tend to make more negative judgment about people identified as having mental illness. Families likely face not only the subjective burden of perceived stigma from outside the family, but also their own conflicting feelings towards the mentally ill members. Mental illness persons can also give effect to the family financial. As we can see that the challenges of families dealing with mental illness are often compounded by financial difficulties. Not only is the family responsible for some of the cost of care for their ill members, but other members' healthcare costs increase as well. Families often have to deal with a loss of employment income when a significant earner is the ill members. Even if a job is not sacrificed, there are often other work-related complications. For example, mental illness have been correlated with increased work stress, high levels of work, and family life imbalance. On the other hand, families need to bear the cost of treatments for their family members who have the mental illness. It is an effort for them in order to make the persons with the mental illness will recover quickly instead of letting them live with that mental ill by their own without any help from their family members. Thus, people who have the problem with the mental health area absolutely giving effect to their family members as well.